Around the world, behavioral health systems are under growing strain. Too often, the support people need is out of reach, and many countries are struggling to keep up with rising demand. The cost of that gap is enormous. By 2030, brain disorders are projected to cost the global economy $16 trillion every year. And yet, experts estimate that tackling brain health challenges could restore 130 million years of higher quality life to people around the world. This pressure has made one thing clear: brain health is not a side issue. It sits at the heart of how we live, work, and thrive. Here in Davos, we're speaking with some of the world's most influential leaders about their concerns and their hopes for what behavioral health could look like if it were built around people, not systems. Together, their voices point toward a future where brain health is recognized for what it truly is: deeply human, deeply shared, and something we all have a responsibility to protect.
Ready?
All right, if you can please find your seats, we're going to get started shortly.
And I'm looking at you, right?
Yep,
Stand
right
by.
here. Okay.
And 5, 4, 3.
So it's very encouraging to see how brain health is being elevated into global health agenda. The brain is the most complex organ in the human body, but the least understood. It's the command center of human life, the source of our thoughts, our memories, our emotions, our creativity, and above all, our relationships. The brain is the engine behind humanity's greatest achievements, but also its greatest failures. It makes us who we are as individuals and as a species. And yet, despite its central importance, and despite the huge burden of disease, brain health has been historically overlooked.
Well, we are here to bang on a drum that I feel very passionate about. Value-based care is really a key pillar to the brain economy transformation. We have got to do a better job of bringing high-quality healthcare that brings value to people receiving it in order to really boost their brain health.
That's why the Davos Alzheimer's Collaborative is increasingly taking the view that we need to study the brain from birth and indeed in utero through life, because you're born with the same brain you die with. And so we have to basically think across the lifespan and across the globe, because otherwise we're not going to defeat this beast.
For too long, we have separated how we think about brain health from our physical health. But actually, these things are extremely integrated. Whatever you do to take care of your heart is taking care of your brain.
It takes a village to educate a child, but it takes the world to cure the brain.
There are things that people can do for their brain health, and they don't have to know it's for their brain health. They can know that it makes them feel good. They can know that it helps them help other people.
We want to make sure that members and patients are getting the right care at the right time and the right place. And they're doing that every single time. And that obsession with making sure that people are getting the right care at the right time, at the right place, happening every single time is core to what a value-based system is. And that drives quality, drives outcome, focus on prevention, the right care that people need to get.
If we are really serious about brain health, brain capital, the brain economy, we are going to have to fix the healthcare system.
If the model only succeeds in the wealthiest countries, those with the most resources, then we're not creating value, we are selecting for it.
Innovation doesn't always need to be high tech. It doesn't need to be something that has not been thought of before. About 2 years ago in North Carolina, we took on something called the Healthy Opportunity Pilot. And we said if we took our most vulnerable Medicaid patients and gave them access to free nutritious food and other stress and behavioral health tools, what would happen to their healthcare spend? What we actually showed in about 12 to 18 months, when you make that investment, you get a reduction in use of about $96 per beneficiary per month.
We launched a set of North Star goals about 2 years ago that's 90, 90, 90 by 2033. So 90% of people screened for mental health and substance use, 90% getting the evidence-based treatments they need, and 90% moving towards recovery by 2033. So really we're shepherding the movement around that while we're doing a lot of the policy and economics work to make that happen.
If you think about global GDP expenditure on healthcare, if we can bend that cost curve down, which Catalight is articulating a strategy for and mobilizing other big players around, that's great for global GDP to reduce the expenditure and then to drive better brain performance and brain capital in societies.
I read a statistic that 1/3 of the economic growth in advanced economies over the last century has been due to health improvements. And that for every dollar we spend in health improvements, we get 2 to 4 in return in economic productivity. But in reality, there's a lot that we have to fix to make this work.
And we can't afford not to fix it.
We have all these leaders gathered today. What is the one message? What is the call to action that you have for global leaders today around healthcare?
Well, the critical message is we have to do this right, not just because it's morally right, but because it's right financially. And that is why we're reframing mental health in the terms of brain capital and brain skills, because now this is not something we can just leave to chance. We have to be intentional about the kind of skill development to help people live their most optimal lives, and not just in the health area, but overall in society.
Everyone across the world, whether you're a political leader, a business leader, or a family leader, needs a brain economy plan. We need brain economy plans for the world, for nation states, for cities, for businesses, and for families. So everyone should get their thinking hats on and think about what is their personal or professional brain economy plan.
But it can be solved, and it doesn't require heavy machinery, high technology. It just requires a willingness to be able to do it.
We can't do this alone. We can only determine what we can control and get as good as possible in it to become attractive to others to work with us.
That's on us to be able to prove to governments, to societies, that this investment in innovation is going to create a health and economic return.
Our shared goal is simple and profound: to enable every person in every country to achieve their full cognitive, emotional, and social potential. If we succeed, we will not only reduce suffering and disability, we will strengthen societies. We will accelerate innovation, and we will unlock the brain capital that the world urgently needs at this moment of rapid change. Together, across sectors, disciplines, and geographies, we can transform the future of brain health for all people everywhere. I thank you. Thank you. Thank you again.